Advanced healthcare directives in Tennessee give clear medical directives for typically acute, irreversible, end of life care situations. Think coma, okay, if there's a permanent unconscious condition, end stage illnesses, a collapse of what we call activities of daily living. You can't toilet, transfer, move, bathe yourself, communicate clearly. Do these scenarios present an acceptable quality of life? And if not, what type of health care would you want? Would you be okay receiving CPR in these instances? Life support, artificial hydration and nutrition, those types of things. Really important personal healthcare directives. This form vests that power with you, not your agent, and it ensures that your medical team are bound to follow those wishes. It's really critical that we vest that power with the client. A common scenario we often use is that Terry Schiavo case from Florida, where that young lady was in a vegetated state for a number of years. It's really important. Your primary care provider is probably screening for this document when you come in and see your physician. It's important you get it done, and it's important that you get it done as part of your overall estate plan. Very different from your healthcare power of attorney, which is your healthcare agent that makes other types of decisions for you outside of those acute situations that the advanced healthcare directive takes priority for. How do I talk to my family, my folks about estate planning without offending them? Money and assets, those things are private matters. But it's really important that you have that conversation with aging parents, that we don't all put our head in the sand. Do you have a will? Have you handled? How are you going to handle the stepchildren or a second marriage that has came into existence over the last decade? Is your estate going through probate court? Do you have a trust? Do you have a Medicaid plan for long-term care, mom, dad? What is the plan? There's a way that you can respectfully engage in that conversation. Also, from a healthcare perspective, what are your healthcare values? Are you okay with life support? Are you okay with artificial hydration and nutrition? Would you want hospice? Do you have a living will? Do you have an advanced healthcare directive? It's important that you get those conversations started in a respectful way, but also that you engage in those crucial conversations. Healthcare power of attorneys. This really important foundational document is part of everybody's estate plan, or it should be. It takes place in the event that you are incapacitated and you can't make important healthcare decisions for yourself. Maybe there's been a stroke, maybe there's been a car accident, there's dementia and Alzheimer's, which is what we see so commonly in our practice. Who should we choose as our healthcare agent? This person is really important. They make decisions. It could be over 24 to 36 months if someone's got serious vascular dementia, progressive dementia, and they're choosing your in-home care team, your long-term care team, your physicians, your treatment plan, all of those things for you over time. Are they local? Is this person, do they have the bandwidth to make these decisions over the long term for you? Do you trust them? And if there isn't an adult child or someone like that as your successor agent, would you be okay with a professional like a social worker or someone who is versed in public benefits and that can be your healthcare advocate? It's really important that you have this document so that we avoid court order conservatorships.